Ethical issues, rights and duties. I'll start the chapter. Just see if the topics match. Okay. So first topic would be somewhat like medical ethics. Okay. So the code of conduct that is accepted voluntarily. All the medical practitioner doctors. Okay, they have to voluntarily accept these medical ethics. Okay, this is the core function of the entire medical practice. Okay, so there are four rational approaches. Okay, so rational means purposeful. Okay, purposefully they are not doing it. uh, if they are doing it voluntarily, it is because there is a purpose behind it, and the purpose of why they have to follow the ethics are given below. So the first is deontology. Deontology means every medical practitioner, they have a duty and obligation towards the society, towards the humanity, to the clientele they have. Okay, so that is a duty and obligation to be ethical. Okay, it is your duty, it's a doctor's duty to be ethical. Okay, there is no way in the medical practice, there is no loophole in the medical practice which will allow the doctor, the practitioner, to be unethical. Okay, it is their duty, they have an obligation. If they have studied MBBS, if they have studied whatever medical practice they have, they're skilled at or they're knowledgeable at. Okay, it's their duty and obligation to be ethical. So that is deontology. Then we have consequentialism. Okay, it is all the judgments are based on the outcomes. If your outcomes are good, okay, if you have given a good medical care, if your patients have recovered, okay, if there is a good medical care, good outcome out of your actions, okay, you will be rewarded. Okay, if there are bad outcomes one after the other, you have to do some check in with yourself. Okay, so the judgments are completely based on outcomes. Okay, all your good deeds are because whatever good you do, you will get good judgment. Okay, so that's consequentialism. Then we have principalism. In for principalism, we can see these four pillars of medical ethics, which is there on the image which I have provided. Okay, so these four topics, these four headings are the principalism. Okay, four pillars of medical ethics. Pillar of beneficence, you cannot hurt people. Okay, you whatever you do, whatever action you take is should be for the benefit of others. Okay, whatever action you take should bring benefit to the to others, not harm. Okay, pillar of maleficence. Okay, you cannot do harm purposefully, do no harm. Okay, that is pillar of maleficence. Then pillar of autonomy. Okay, what do you mean by autonomy? Do you have any what is your take on autonomy? Could you please answer in the chat box? What is your take on autonomy? What do you consider if you hear the term autonomy? What comes to your mind? Could you please put it in the chat box? So every person have their own values, beliefs. Okay, they have their interest. Okay, yeah, without any external factors making you decide something, whatever is internal, okay, to you, your internal principles, your belief systems, your interest, okay, your willfulness, okay, your actions should come out of that. Okay, your actions should not be governed by external factors. Okay, your thought process, your skills, your interest, your beliefs, okay, your values, your principles should govern your actions, nothing from outside. That is autonomy. Okay, then we have the pillar of justice. The justice has to be served, do not be biased. Okay, here for medical practitioners we can say is do not be biased. Okay, Then virtual ethics means all the good actions when you're being honest, when you're being truthful, okay, when you're being respectful, when you are courteous, okay, when you show all these good habits, good manners, it is a virtual ethics, it is seen by others, okay. Your honesty, your trustworthiness, okay, the good in you, okay, the benevolence what you have towards others, okay, your concern for the humanity, okay, your respect for your fellow colleagues, your patients, as well as people in general. So these are virtual. Why virtual? It is seen and palpable by others, okay. This is by virtual ethics. So these are the four rational approaches of medical ethics. Now coming to history of medical ethics, in India, in ancient India, we had the Charak Samhita, okay. Charak Samhita, it's not just about particular disease and what treatment we can give or what surgery we can do. Okay, Charak Samhita and Shushruta Samhita. Shushruta Samhita is about the surgical scenario. Charak Samhita is general about the general medicine, okay, community medicine, okay, public health, etc. So Charak Samhita, it is not just about a condition, a disease, diagnosis, and treatment. No, it's not just about that. It also had valuable insights of what was the system of governance, okay, political governance in those period of times, okay, what was the basic public administration, okay, what's the history, okay, even the history of people, how they lived, okay, what was their kind of way of life, everything is written in detail. So it is a treatise, okay. So that is Charak Samhita. It is not just about medicine, but it is also about the society in general, the society how it was during those times. So because of Charak Samhita, we do not have just valuable insights towards the Indian branch of medicine, but also the history of the people who lived during these times. Okay, that is Charak Samhita. Then we have the Hippocratic Oath. It originated in Greece. Okay, so early it was lost. Okay, by it was made in 400 BCE, you know, but it was before that, but it was lost. Okay, during archaeological findings and all, we got back the Hippocratic Oath. Okay, Hippocrates was a very well known physician in Rome and Greece, etc. So he had formulated certain do's and don'ts, what his students should conduct themselves when they are practiced. Okay, so that is Hippocratic Oath. Even today, when the Hippocratic Oath is taken by the MBBS students as they pass out from the medical college, okay, and this oath has to be upheld throughout the entire professional career they have. Okay, then we have the Declaration of Helsinki. Declaration of Helsinki is majorly concerned with the medical research done on humans as well as animals, ethical medical research. What are the ethics of putting human beings as subjects in a medical research? Okay, how to go by it. So, Declaration of Helsinki came. The importance of Declaration of Helsinki is after World War Two. Okay, after World War Two, during the World War Two, Germany was notorious of conducting these harmful and torturous human experiments on the Jews. Okay, Nazi Germany was conducting all these inhumane experiments on human subjects. Okay, so this type of torture should never happen in the future. Okay, so that's the reason why we have Declaration of Helsinki. Even at war or even when not at war, okay, countries at war or not at war, you have to uphold the Declaration of Helsinki. Okay, when you hear the term Declaration of Helsinki, please remember that it is largely based on the code of conduct of researchers, medical researchers, towards their human subject and towards the research in general, okay, towards the unbiased research in general. That is Declaration of Helsinki. Then we have Declaration of Geneva. It's about the humanitarian aspect of medical professionals. Okay, how they will uphold their own health as well as their patient's health. They will not even if they are treating the enemy. Okay, even if the doctors are treating a political or geopolitical enemy, but they will show the same humanitarian attitude towards their foe and enemies what they have shown towards their patients so far. All these kind of concepts are seen in Declaration of Geneva. Again, Declaration of Geneva should also be upheld by countries who are even who are at war. Okay, even in those tough times, you have to uphold this Declaration of Geneva. The practitioners has to uphold this. Okay. So International Code of Medical Ethics, we have duties of doctors towards the sick, doctors towards each other. Each part of this we will discuss in detail in the coming up slides. Okay. So WMA, the World Medical Association, which gave the Declaration of Helsinki as well as Geneva Declaration. Okay. They had when they found out about Hippocratic Oath. Okay, so they thought that this is a well-fitted oath for our future doctors, so they did some restatement of the Hippocratic Oath. Okay, the original Hippocratic Oath is uh, the words used, the statements used. Okay, the phrasings were quite different. Okay, how the Greeks used to say it, that was different, and they restated it. They translated it into various languages. So this work was done by the World Medical Association. So the as just like the Declaration of Geneva, Hippocratic Oath will also be applied during peace and war. So coming to Declaration of Helsinki, what is Declaration of Helsinki? So it is a set of ethical principles one has to follow, especially uh, when you are following the research. Okay, and when you're doing the research on human subjects. Okay, so it is developed by the World Medical Association for medical community, especially for human experimentation. Okay, pharmaceutical drugs or any new technique, any advanced medical techniques, etc., or any equipments, okay, which is being tested on humans, you have to follow the Declaration of Helsinki. It is followed by the Nuremberg Code. Nuremberg was a place in Germany where they used to conduct this inhumane, in Nazi Germany, when they used to conduct this inhumane test on human beings, on Jews and other what they considered racially inferior subjects. Okay, so after the World War II was over, in 1947, Nuremberg Code came up. Okay, to protect the people, to especially the people who are vulnerable from poor socioeconomic classes, to protect their health from falling into this inhumane research trials. Okay, so Nuremberg Code was restated, rephrased, and it was relaunched as the Declaration of Helsinki. Okay, so it is regarded as the cornerstone document of human research ethics. Okay, for if you are doing any research on human beings, wherever be your research center be, okay, this has to be followed by all the practitioners who are involved in a human research. Okay, also in clinical trials. Okay, when you see that your research is successful, okay, you have few sample of people, and based on this few samples your research is successful. Now you have to go for the clinical trials. Clinical trials will not be vast spread, it will be given to only few selected few clinical cases. Okay, and even when you are doing when you are processing your successful research results on the clinical trials, you have to still go by the protocols given by Declaration of Helsinki. So what is Declaration of Helsinki? Most of the main protocols that comes under it. So conform to accepted scientific principles, that is evidence-based medical practice. Okay, whatever is evidence-based, go by that law. Okay, do not directly have some speculations or wild speculations and try something new. Do not go like that. Whatever is evidence-based, you utilize the maximum theories, principles, and techniques from evidence-based medical practice, and then go further down. Okay, and designed formulated in experimental protocol, it is reviewed by the International Ethical Committee. Okay, whatever is your research design, whatever is your research methodology, questionnaire, or what kind of pharmaceutical combinations you're going to give, how long this research will last. Okay, what are the side effects we are thinking that it may take place. Okay, all these things are reviewed by the International Ethical Committee first. Only when they give you the green signal, okay, your research is fine, ethically it is correct, now you can go forward. Okay, only then the research trial will be jump started. Otherwise, until and unless you get an okay green signal by IEC, International Ethical Committee, you cannot work on your human research. Okay, and it is conducted by qualified and trained persons. Okay, those who are medically qualified, those who are professionals. Okay, undergraduates will not do any part, will not partake in clinical research. Okay, 1 minute. So next we have importance in proportion to inherit the risk, to inherent risk. So every clinical trial will have an inherent risk to the subjects. Okay, so uh, there will be a certain proportion of inherent risk. For example, when there is a surgery, okay, whenever there is a surgery that is going to be conducted, the surgeons will give you the proportion of risk, okay, and the proportion of success. Okay, this surgery will be 95% successful. 5% we do not know what will be an unprecipitated moment, okay, unanticipated incident that may take place. We do not know. Okay, so that's a risk. So 95 and 5%. So what you will think, okay, 95%, the doctor is guaranteeing 95% this will be successful. Okay, the probability of this surgery being successful is much more. Okay, it is the probability of the surgery being successful is much more than being a loss. So we will go with the surgery. So that is a proportion of inherent risk. So even in research also you will have the inherent research. Like if we go by this theory, if you go by this assumption, there are 80% chances that this medicine will be successful. 20% chances are there that we may lose our research. Okay, so still you can understand that you can do the difference of inherent risk here. Okay, the importance of inherent risk here. So 80% it is guaranteeing you that this medicine could be successful. Definitely you will go along with that. Okay, but if there are cases that the inherent risk is 50%, okay, we just have a 50-50 chances of saving a human subject, or we just have a 50-50 chances of seeing that the medicine will work or not. In such cases it's very tricky. Usually your research will not be allowed to be carried on. Okay, that is assessment of risk versus benefits. Okay, assessment of what are the side effects, what are the contraindications, versus what are you trying to gain from the research. Okay, that is also assessed. Risk and benefit is tallied. If there are very little risk and too much benefits, definitely yes. If there are very little benefits to your which are supposed to come out from your research, but there is a whole lot of risk involved, it will be declined. Okay, safeguard the subject's integrity. Privacy of the subject has to be kept confidential. Okay, abstain unless hazards are predictable. Okay, if you know that hazards are going to take place, severe health hazards are going to take place, do not continue the research. Stop it. Okay, preserve the accuracy when publishing. Do not publish a biased research. Okay, the research as it is, as you moved on, the data should be captured and it should be published as it is. Do not cause any bias in translation, editing, etc. before publishing. Adequately inform or right to withdraw. For example, when you are selecting the human resource or subjects for a specific research, you have to inform them what are their what may be the benefits they may be receiving, what risks are there, side effects, what and all are there, what is contraindicated, etc. Everything you have to inform them. And they also have the right to withdraw after listening to all the risk benefits. They will also do some their own calculations, etc. And after that, if they do not want to carry on with your research as a subject, they can willfully withdraw from your research. Okay, obtain true informed consent in writing. Informed consent, I guess you know, in their own language, with all the risk, all the benefits, all the options what they have. If not with this particular solution, everything has to be explained properly. Okay, in a language or in a way comprehensible by the receiver. Okay, reliance on a legal guardian. If the human subject is minor, okay, you have to depend on the legal guardian for it. Or if the human research is mentally unstable or mentally challenged, in that case also legal guardian is sought for all the consent related activities. State compliance with declaration, whatever is your whatever actions you are taking in your research, okay, how is it complying with the declaration of Helsinki? You have to mention that. Okay, declaration of Helsinki has said so and so statement, we are also following the same thing in our research, like that. Your research, whatever actions you take, should be compliant with the declaration of Helsinki. Okay. Next, coming to ethical challenges in healthcare, clinical practice. When especially when you are publishing a research, okay, it was successful. The whatever trials you have done is successful, but when you are going to launch this research, the researched medicine or researched technique on a large scale, okay, if this knowledge is going to be published and people are going to use it on a large scale, okay, how ethically are they going to use your knowledge? That is a challenge, okay, in clinical practice. Okay, the way how you have perceived your research to be utilized will not be the same way how it is actually being utilized in the hospital. Okay, so for your research to be successful, you may have some preset conditions. Not every hospital or every clinical area in the hospital may have that preset conditions involved, which will regulate the researched medicine or technique what you have bought in. Okay. Next is research. About the ethical challenge of research itself. Okay, people are not that aware. People are not that aware of their rights. Okay, whatever human subjects are there, usually they will not. They are patients, patient party, something like that. They are not aware of their rights, what they can do, what they cannot do. Okay, how far they can go. So and it this unawareness could be misused by some. Okay, so that is another ethical challenge. Public health and policy, the same way, if your research is supposed to become a mandatory public health policy, okay, there are very nitty-gritty parts of it. When the government is getting involved in your research, and when your successful research is going to be used worldwide by all the healthcare governments, it becomes very tricky. Okay, the present day regulatory vacuum that we have, we do not have, apart from the International Ethics Committee as well as the Helsinki Declaration, we do not have any other body that it regulates human trials or human researches, or the knowledge that we get from human researches and trials. How is it being used in the hospitals? There is no regulatory body that overlooks this. Okay. Now coming to the rights and duties of the doctors. General duties: maintain good medical practice. Okay, you have to maintain the medical records. Registration number should be shown. Okay, it should be visualized. It should be in a visual setting for your patients and your fellow doctors to see what is your registration number, and even on your prescription. Okay, your registration number should be mentioned. Generic names of the drugs has to be used, not the brand names of the drugs. Quality assurance has to be instilled in the doctors themselves. Okay, a quality assurance should not be a responsibility of somebody else or the hospital administration. Every medical practitioner has a right of quality assurance that they have to follow in the practice. Safeguard the profession. uh, Whenever you see anyone else, even your colleagues, okay, if they are doing any malpractice, okay, you have the right to inform it to the uh, authorities. Okay, so that's how you're safeguarding your medical profession. Then expose unethical conduct. The same thing, when you see malpractice that is being done by somebody else, expose it. Okay, do not think that this colleague is my friend, I can't go against my friend. Okay, if they're doing some harm on their patients, if they're doing any malpractice against the medical ethics, you are obliged, you are bound by your uh, Hippocrates oath as well as your registration. You have to inform the authorities. Payment of services, it's not like that. You will not give your services if you do not get the payment. Okay, you cannot go by that. Okay, and whatever is your fees, whatever is your consultant charges, etc., it should be declared before you give the service. It's not come as something shocking or surprising for the patients after at the end. Okay, before you give your treatment, before you give anything, any medicine, your consultation fees, your treatment charges, okay, your service charges, everything has to be mentioned properly to the patients. Duties towards their patients, obligations to the sick. Doctors have an obligation to the sick to take them back to their health. Okay, every sick person who approaches you, you have an obligation to take them, to do your best to take them back to their health. Incapacity to practice. Can you say any examples in the chat box? In which conditions can we say that uh, a doctor becomes in this category, incapacity to practice? In which all situations? Okay, in which and all situations? Some examples can you give in which you can state that? Yeah, when the license is revoked or the registration is cancelled. Malpractice. Any healthcare issues? Any health related issues? Yeah, any health issues or even mental health issues as well. Okay, in such cases also the doctors come under the category of incapacity to practice. Okay, and even for example in certain cases for surgeons and all, if they have hurt their hands, okay, if they have hurt their hands, or if they any accident or any medical injury on their towards their hands, which lead them not being medically fit to perform the surgeries any further. Okay, in that case also they come under the incapacity to practice. Any health issues also which leads to this, they come under incapacity practice. And secrecy of the patient's information has to be maintained until and unless it is a court order. Okay, explaining the prognosis, like do not overhype your treatment or do not underwhelm your treatment. Okay, as it is the success, give them the realistic success rate of your treatment or procedure. Okay, patient neglect has to be avoided. Okay, even if you're spending just 1 minute with your patient, okay, give your entire thoughts and give your entire attention and focus to that particular patient. Okay, even if you're like spending you have very few hours of duty, but you have to treat n number of patients in that particular time. So whatever patients you are on, okay, your focus should be on that particular patient. Do not think about other cases while you are dealing with a specific case. And consultations, duties during consultation, avoid unnecessary consultation just for profit making purposes, etc. Avoid unnecessary consultation. Observe punctuality, be punctual. Informing the patient about their realistic medical condition, do not hide anything from the patient. Okay, whatever it is as it is, you have to inform the patient. Treatment after consultation, what they have to what they have to carry on, how long they have to carry on, be truthful in that. And if they, even if the patient wants to go for second opinion, support their decision for that. Charges should be informed, whatever is their payment, whatever is their charges, it has to be informed before you carry on with your treatment or consultation. Responsibilities of the doctors towards each other, dependence on physicians on each other. They are like, if a doctor requires an assistance of another physician, okay, the other physician is obliged to assist. Okay, Conduct in consultation. Do not badmouth other doctors. Do not say bad things about your colleagues to your patients. Okay. Consultant not to take charge of any case. Whoever is the consultant, but who is not the like physician. Okay, just a consultant. Okay, just give your consultation and give your health education to the patient. Do not just take over the case. Okay, do not take over somebody as other doctor's case. When other doctors refer their patient to you, do not take over that case. Okay. Appointment of substitute. If you are going on emergency leave, okay, if you cannot reach your duty on time, in appoint a substitute in your place to see your patients, to give your duties towards your patients. Visiting another physician's case as well, and when you are doing that, it's usually when it is a referral case. Do not badmouth any other doctors. Okay, do not badmouth the consultant or the physician, or the treating doctor. Okay. So towards the public and the paramedical physicians as citizens. For example, I can give the corona example. Whenever there is a corona case, a new corona case that they have come by, okay, COVID-19 case which they have come by, they are not supposed to. The physicians are supposed to inform the authorities if they come to know COVID-19 case is not for following the quarantine rules, etc. Okay, the physicians, they are bound to inform such negligent activities by their patients, just to protect the public in general, just to safeguard the health of the public in general. If you know somebody is a threat to the public health, you have to take actions against that particular threat through law enforcement. Okay. Then public health, whatever, like there are specific notifiable diseases, okay, or some occupational health diseases, some epidemic pandemic causing diseases. Okay, number of dengue cases, malaria cases, chikungunya, vector-borne infections. Okay, these are notifiable diseases. So whenever you come across any, or whenever you're treating a notifiable diseases, it is you are obliged to notify the public health authority that I have got this particular case, or this particular case will be added on to the list of cases you have consulted, and the list will be sent to the public health authority. And towards pharmacists and nurses, be respectful. Whoever is your paramedic, fellow paramedics, uh, allied health care practitioners, okay, be respectful towards their duty as well as a person, and as well as towards a profession. Whatever skills sets they have, be respectful to that, towards that. Next, coming to unethical acts. Advertising. No doctors are supposed to advertise themselves. Okay. Rebates and commissions. Avoid getting into this trajectory. Okay, some pharmaceutical companies will always be there to approach you. Okay, they will give you some commissions if you write brand names of their particular medicine, okay, for the patients to use. So don't uh, fall into such commissions cycle. Okay, using secret remedies, whatever, like according to the Drugs and Cosmetic Act in India. Okay, in India it is a Drugs and Cosmetic Act. So what pharmaceuticals the Drugs and Cosmetic Acts has allowed, please use that. Okay, do not use any unresearched or medical remedies, or something that is herbal or something like that, which does not have an medical evidence or research to prove its benefit. Okay, do not use such medicines or DIYs, etc., on your patients. Human right violations has to be avoided in whatever form. Okay. Euthanasia, whatever is the rule of euthanasia in your country. In India it is banned, but there are certain countries where it is allowed. So euthanasia, whatever, whichever country or whichever land you are practicing your medicine, whatever is the law behind euthanasia, whatever is the uh, take on euthanasia in that particular country, okay, just follow that. Code of conduct has to be maintained. All your code of conduct, ethical conduct, what doctor has to follow in a specific country, it has to be maintained. Violations of regulations, legal or your medical. Okay, please avoid yourself from getting into any regulation violation cases. Or adultery and improper conduct. Okay, these are also, this could be punishable. Adultery in the sense of giving wrong medication or mixing something else with the medication and then providing it, lacing the medication with something else and providing it. Conviction by the court of law in case of medical negligence and malpractice. Sex determination test in India, it is a malpractice. Signing professional certificates, etc. Okay, like medical fitness certificate, or giving a sick certificate, etc. Okay, so be very do not be corrupt in such cases. Okay, just because they may be paying you some money to give make a fake certificate, do not fall in that. That's a violation of your profession. In research also, whenever you're conducting human research or when you are collecting knowledge from the human research, make sure the research is valid enough for you to use it as an evidence-based medicine. Any doubts here, please mention in the chat box. It would be better if you could just revise the chapter today itself.